A new surgery center at St. Mary's Hospital in San Francisco is using a teamwork approach to complex reconstructive procedures. Specialists from St. Mary's and UCSF are partnering to offer state-of-the-art microvascular surgery for patients like Garrett Lefevre, who lost part of his hand in a woodworking accident.
Using a table saw, and the piece I was cutting got kind of bound up in between the blade and the fence and popped back and cut my thumb off.
Doctors reattached what was left, but the results were poor.
The circulation was so bad that I just never really fully recovered. It was kind of stuck in a downward position.
The thumb is responsible for about 40% of the function of the hand, which is why when doctors recommended taking Garrett's big toe and using it to create a new thumb, he felt it was his best chance of regaining the use of his hand.
I wanted to do it. I was sick of it, having that thumb, and if there was an option to get out of it.
The ambulation and the function of the foot is minor compared to the gain that he gets in his hand.
Dr. Charles Lee is director of microsurgery at St. Mary's Medical Center. He and UCSF plastic surgeon Scott Hansen performed the complex 6-hour procedure as a team at St. Mary's Plastic Reconstructive and Orthopedic Surgery Center. Dr. Hansen removed Garrett's toe.
It takes about an hour, hour and a half to dissect the tendons, the nerves, the blood vessels, the bone, and to get it prepared to detach it.
While he was doing that, I prepared the hand, meaning I got all the blood vessels and nerves and all that stuff out for dissection and for us to, when we're ready to basically do the osteosynthesis, meaning reconnect everything.
I feel a sensation there, but not a shock.
Now, a month and a half after that microvascular surgery, Garrett's new thumb is recovering nicely.
As long as I don't put this hand near it, it looks like a normal thumb.
As for the loss of his big toe, Garrett's getting used to that as well.
The big toe helps in stabilizing you in that first step, but as he learns to walk without his big toe, he'll be able to run and function normally. Nobody would ever know when he has his shoe on.
I want you to bend your wrist. Let me see. Okay. Good, and then bring it back. Good.
He's diligent with his hand therapy. Within 6 months, he should have about 80% function. He's not sure if he'll ever return to carpentry, but Garrett's confident, thanks to the team effort at the St. Mary's Pro Center, he'll have a hand that works.
Well, we can shake with the right hand.
Shake with this one. I can do that now.
Surgeons expect the size of his transplanted toe will shrink about 20% over the next year, making it look even more like his other thumb. Go to abc7news.com for a link to the doctors and the Pro Center at St. Mary's. Just click on Health.
Pretty amazing. When it shrinks, it really will look a lot. You can only tell when it's right next to it.
Yeah, exactly. It already looks pretty good.
All right, well, more rain at least.